I have so many questions. This has been amazing, Dr. Webb.
We'll have to schedule
Thank
a
you
part
so
two
much.
for Giles.
Thank you for doing this, and also thank you for running for Congress to do this.
Absolutely.
Because we need people who understand this world and understand medicine up there. I guess I had a big picture question, which is with this initiative that the new administration is rolling out for COVID response. Do you think it builds a framework for an actual public health system in our country going away from this? Because you said most people don't have a doctor, and that kind of kept echoing in my ears. How are we going to be a healthy country when most people don't have a doctor, and their main orientation is to avoid the doctor?
Right.
And so I'm just wondering if you think that this builds a runway for people like you and for a federal initiative to start building what would look like some type of public health system that means people have doctors who they trust.
And Giles, I think again, the lawyer in me, alarms going off. It's like I'm always careful not to speak on behalf of the administration.
Sure, I understand
myself, but I think that what I would say is that COVID-19 has changed the game. It's changed the game in terms of what we know about the American healthcare system and how we are also interrelated, also impacted. And I've spent a lot of time thinking about this, even from back when I was campaigning for Congress, to now heading into the administration in a pretty different capacity, working on COVID and working on equity. We realized just central to the ability for folks to get and stay healthy, you got to have access to care. And so I think that it does highlight that conversation. And then, like you said, public health infrastructure, I think the proof is in the pudding. Over the last year, we've just seen we don't have an adequate public health infrastructure. We don't have the workforce. We don't have the ability to rapidly respond to potential crises, right? We just weren't prepared. What I do know is that this administration, they're definitely keeping that stuff in mind. What President-elect Biden said the other day when he kind of announced his American Rescue Plan was that first we're talking about rescuing our nation from the grips of this pandemic. Like that's what we need to do. That's getting vaccines in arms, getting shots in arms. That's making sure that people have the resources necessary to kind of make it through day by day. There's a whole recovery element of this too. Additionally, what President-elect Biden has said that he's going to be rolling out as well. And so you've got recovery from all of the pain and the challenge economically and socially and from a health perspective that this pandemic has caused. And then there's the, hey, America, wake up call. Do we have the kind of systems necessary to have a healthy nation? And I think that a lot of people can answer that question with I don't think so. It's not equitable. It's not fair. Everybody can't say that, our neighbor has access to the care they need when they need it. And so that can take a lot of different forms, but I do think you're going to see a resurgence of those conversations. I think putting my political pundit hat on, we got a different moment because we have, of course, I'm a Democrat and I ran as a Democrat, and we've got a Democratic House. We've got a Democratic Senate now, got a Democratic president.
Hey,
and
no excuse.
All three have been saying we need access to care for folks. So
right.
It looks like a good moment to say, what does that look like? How do we get that done in these next 2 years? I think that the urgency right now is getting through this COVID crisis, but I think it would be folly not to look at how we can expand access in this moment too.
Yeah, Ms. Max, kick it to you.
Yeah, I have two questions for you, Dr. Webb. So I have children between the ages of 4 years old to 16 years old. Mm-hmm. And I'm curious just what your thoughts are in terms of vaccinating children. I know for a long while they were talking about kids were less likely to get it. When they did, they were less likely to die from it. Are they even turning children away because they aren't, they just don't fall in that category of their health being more compromised, Yeah. So that's the first question, vaccinating children. And then the other actually comes from a reporter with Charlottesville Tomorrow. And I believe she's heard that UVA is doing well with administering the vaccine, but that the local health department is facing some challenges. And so she's just wondering, is that staffing issue? Is that a supply issue, or what the scenario might be?
Yeah, I could just say, I think we were hearing that the hospital is doing 1,000 a day and that the health district is not, there yet, although the systems are interrelated. So it was kind of like, well, what's going on there?
Yeah.
Mm-hmm. Yeah. Well, so I'll start with the vaccines in children question. I think that, Ms. Max, the first thing to know is we don't know. When the studies were designed for the Pfizer vaccine, children weren't included. It went from 16 and up. 16-year-olds, we know 15 to 18-year-olds, they behave kind of like adults when it comes to COVID in terms of, they're similar to a 25-year-old. Their body, they may end up with some symptoms from it and whatnot. They don't tend to get as sick as older adults or folks with chronic medical conditions, but they can get some of those other symptoms. But the vaccine trials didn't include kids on the front end. Moderna started adding in kids in their trials. So they had kids ages like 12 to 15. And I think Pfizer started adding in some kids as well. And the hope, and I've heard this from several people, is the hope is that, we're enrolling some older children now. They're going to start enrolling some toddlers and younger kids later. And the hope is that, it's very possible by the end of the summer, we might have, vaccines going to kids as well. That could be a good thing. We know that, interestingly, kids are usually ones passing colds and flu around households, but with COVID, it doesn't seem like they are the ones who are usually bringing it into a household and making everybody sick. It's kind of a unique dynamic. But just the same, we never know how a future variant may work. We know that the UK variant, there are some early indicators that look like, hey, more kids might be getting sick just because it spreads more visually. It spreads to more people. And so we're seeing more kids getting sick, and that's going to be the dominant variant by late March, early April. I think that it's just like, okay, we don't want kids getting sick. Like, period, hard stop. We don't want kids getting sick. And so I think that there is a lot of interest in figuring out how to protect kids as well. We also know there's a multi-system inflammatory syndrome in kids, MISC, that causes a lot of challenges. It happens very rarely, but if you see higher numbers of kids getting COVID, that rare outcome is going to happen to more kids, and we don't want to see that. So again, you're going to see a lot of interest in kids, and I think that by hopefully mid to late summer, you might see some efforts to vaccinate kids as well.
Okay.
To the second question about kind of the vaccine rollout, I'm pretty aware of what's happening at UVA, and I know that, certainly this was phase 1A, and we haven't spoken about this yet, but this idea of a phased rollout of the vaccine, it was rooted in this idea that we want to prevent unnecessary deaths. But the first phase 1A, was really what we called the jumpstart phase, which was trying to get healthcare professionals vaccinated first and folks who work in healthcare settings. And the reason is that we need healthcare, our system, to stay afloat. We can't have healthcare workers getting sick and dying because we'll have nobody to take care of the population if they got sick, right? So we wanted to get them vaccinated first. That phase 1A here in Virginia, that's about 500,000 people, so we wanted to make sure they were all vaccinated and good to go. That's not just doctors and nurses. We're talking about transport. We're talking about food services. We're talking about everybody, the techs, everybody who makes a hospital run. They all needed to have access to that vaccine. And I'll tell you, we've had some success at UVA in terms of getting folks vaccinated, but there's always more room to go. We still see the same challenges of vaccine hesitancy in certain parts of the population. And so we still need to get more people vaccinated. But doing a good job of getting shots in arms. And I think that's good for our community, especially because it's such a big employer. I don't have as much insight. I haven't been involved in the conversations over the last couple of weeks with anybody from the Blue Ridge Health District. That's the new name for the Thomas Jefferson. Because I've been doing work more federally, but I think that I know that their intent, and I've seen their posts on social media, on Facebook and on their page, they're revving up to get to phase 1B, which is getting to beyond just our healthcare professionals, healthcare workers, but getting to all essential workers, which are our teachers, our childcare, our transportation, our food service and delivery, all of those different dynamics. Every essential service, they fall into phase 1B. All adults over the age of 65, they fall into phase 1B. Every adult with chronic medical conditions, they fall into phase 1B. So we're heading into the part where you really get the big swell. And so I think that's a different dynamic. It's one thing for for healthcare systems like UVA or Sentara Martha Jefferson to be able to vaccinate their healthcare workforce. It's a different dynamic. I think now we're looking at how this plays out with the larger population. I know the Blue Ridge Health District has been building to that and making sure they have max vaccination sites. I know Governor Northam talked about it the other day. I know that they're planning on using some larger localities, some larger spaces locally. And so, I think it's a little early to say that, it's not going well for Blue Ridge Health District, because we're really about to see in this phase 1B how the public health vaccination effort really ramps up and really does its job. But I would just keep a close eye over the coming days and weeks.
Thank you for that.
Thanks.
Wow. I think this is a good stopping point for now, and I know, Cameron, every time I tell you it won't take that long, but you have such fruitful conversation. So it's not even my fault, brother. Like you just have so much fruitful conversation.
It was me. I'm a Gemini. I like to talk, but the thing is, I think it's so important for us to get this information out.
Yes,
I look for every opportunity to answer questions. Dr. Tyson Bell, who's an infectious disease doctor, critical care doctor at UVA, he and I have been doing a weekly COVID update every Monday night from 7 to 8 on Facebook Live. And so if you went to facebook.com/Dr. that's Dr. Cameron Webb, every Monday night, 7 to 8 p.m., we just do Q&A for an hour.
Awesome.
And I think it starts with listening to people, hearing where they are. Some of it's a mix of just questions and then people dropping in the comments their own experiences, their own concerns. And so it's so important for us to have this conversation as a broader community, make sure that we're all getting our questions answered, because you can't expect people to just fall in line. This wouldn't be America if people didn't have some pushback. And so it's important that people take their time to make sure that they know that they feel safe, they feel comfortable. What I hope doesn't happen, I hope that we avail ourselves, we make every opportunity to answer those questions now, right? Because there are a lot of people who are like, oh, I'll wait, I want to see some other people vaccinated. Well, listen, while you're waiting, you might get sick. My mom got her shot yesterday, and I always tell people that my mom got her shot yesterday. And so you need to look no further than my love for my mama, and no, I would not let my mom take a shot that I didn't feel 120. Like, listen, I'm young, I'm healthy, I'll take on a little bit of risk. My mom's 65 years old. Sorry, Mom, I didn't mean to tell your age, but my mom's
shout out to Mama, man. Shout out to Mama.
I'm gonna get a whooping. But I wouldn't let her. I would never advise her to get something that I didn't have complete confidence in its safety and its efficacy. Right. And so when she came to me and she said, hey, let's talk about this, and she's on those Monday night Facebook Lives every week, but when she was like, hey, what do you really think about this? I gave her my full unqualified support for her getting this vaccine. And my dad's going to get his. He's not 65 yet, but he's going to get his soon too. And I think it's so important that people realize, like, listen, my loved ones, I'm recommending it to them too. It's not just because I'm part of some machine. I want the public to be sheep and follow something. It's because I want my parents safe, and I want them here for next Christmas. We couldn't do this Christmas. I want them here for next Christmas so that we can spend it together. So that's why my parents got the vaccine. My mom got hers. My dad's getting his tomorrow. And I hope it's kind of one of those next steps in our family getting back to normal.
Yeah. Cool. Awesome. So y'all heard it. Tune in tomorrow night
information
with Doctors Webb and Bell. Yeah. Max, want to take us out?
Well, listen, I'm just now checking my texts, and it says, ask Dr. Webb about gyms. So he's laughing. So
I can do that one because I love going to the gym. It's a part of my gym, and it's part of what keeps me sane. And the gym that I attend, they've done a pretty good job of putting some safety measures in place. But again, as I've been saying, this new strain, little less forgiving. Gyms are the kind of places, they're indoor, enclosed spaces. People are breathing hard. Those are the kind of spaces where a virus like this can spread, right? So you got to be wiping down machines. If you are the kind of person who's willing to go to a gym, then you better be one of those most careful, always wear my mask, wipe down every surface, stay 10 feet away from everybody. If you're that kind of person, then yeah, I can see you making a gym work for you. But understand in these next couple of weeks and months, you got to be extra careful. So, I mean, I'll be full disclosure. I do still go to the gym. I am also pretty careful at the gym. And I think that, I feel more comfortable at the gym now that I've had the vaccine as well, just to be candid. And so, so gyms have always been one of those spaces that we say, like, hey, we want people to get exercise. It's good for mental health. And I try in every one of these conversations to hit on mental health, because let's not lose track of the fact that's a huge part of this dynamic, and people need to protect themselves and protect their mental health, especially with all the isolation. But keep in mind, the gym is a place that there is some risk. And so make sure if you're there, you are ultra careful and kind of going above and beyond to follow all the protocols.
All right. Awesome. Thank you. I appreciate that.
Good stuff. Thank you, Dr. Webb, as always. And until next time, man, stay safe, man. Keep grinding. You are an inspiration, to us, man. And man, yeah. So much success in this new year. With all the new endeavors. Until we see you next time, appreciate it.
That's right.
Thanks for having me. Y'all take care.
All right, take care.
Bye.
All right, MHO family, we will be right back, and that was Dr. Webb.
Such a great conversation.
Yeah, bringing us up to speed. When it comes to the vaccination. Yeah, I know there's still some naysayers. Like we're still getting the inbox, but the best we can do is educate ourselves and just be real with ourselves. And as he said, always check, with your trusted primary care physician if you still have any questions. And he also said he and Dr. Bell are on every week, taking live questions and comments as well. So tune in to that tomorrow night. And like we said, next hour we are going to be joined by Dr. Kevin McDonald, the VP for Diversity, Equity, Inclusion, and Community Partnerships at UVA. And I'm going to be talking about the MLK celebration this year. I believe this is his first year in that position. So now he is taking over, sort of directing the big celebration that runs through the end of the month, I believe. For is put on by UVA and the community. So don't want to miss it. Much more show and some more of your favorite segments and talk is Sir Charles, is Miss Max, is A.A. Ron. I'm H.O. Y'all.